when they present themselves. But there is a certain complexity that demands our time, our caring, and our compassion. I am really, for the life of me, I never thought I would do this for the next, for the past 20 years, but I'm loving it. I am now in budget management, strategic planning, and that's what I do. I listen to our students, I'm visible on campus, and I know exactly what they need. I look at where we have, our budget is small. We are student funded, so right now we're actually 1,500 students down. You could imagine the $500,000 that we will not get. So that really hurts. And to actually look at that and to provide all the services that we're providing is really amazing. And I tell myself, and I tell my colleagues, if I can get my care at the Student Health Center with the types and the expertise of these folks, I will get it. We are not in the place or an institution that actually produce revenue. We are in the area of caring, and I think that's what makes college health so unique. And so I am so blessed to be here. I'm so honored to be with you folks. I'm so grateful for everything that you do and for all the people that have inspired me. I am so grateful and thank you. The other thing too, if you're ever a veteran, happy Veterans Week. I am also saddened, very saddened, and the CSUN, Cal State University Northridge, is very saddened by the fact that the gunman for the Thousand Oaks borderline grill was a CSUN student. We are so deeply saddened by that. A horrific time for our community. We have a Veterans Resource Center. We went there today. We had our counseling services there today to ensure that our students are really coping with this. He was a Marine. He was a young man who actually went to Afghanistan at the peak of his career. We still don't actually know the cause or the reason of this issue or this concern. But our heart goes to the families and of all the families and their friends that are involved and affected by this loss. And on that note, I will take questions, but I just want to say thank you so much for inspiring me in my career. Thank you so much for being exemplars for me and for being able to commit to a career that really tells everybody, that our physicians, our colleagues, that we do have a place on the table. We do have a voice. It's really unfortunate that we didn't have legislators today, because knowing the panel here, you could, and all of you, and sharing your passion, your commitment, and your dedication, thank you so much, because other than that, we would have much sicker people out there. So thank you.
Any questions for any of them? You would like to be a hospitalist? There you go.
I have a question.
Go ahead.
So it really is very inspiring to have all of you here. So thank you for sharing your experiences. My question is, being a nurse practitioner in the roles that each of you have, and this isn't directed to any one particular panelist. My question is, how would you facilitate where your role is, how do I say this? Sometimes it's difficult to sit with nursing staff, bedside nursing staff. And then there are physician provider staff. As a nurse practitioner, yes, we are providers, but how do we bridge the care between our role as nurses first and providers? Does that make sense, my question? Like how do you sit? Because sometimes me as a provider, I always feel sandwiched in the middle. I don't really fit as bedside anymore, and I'm not an MD. Does that make sense?
it's very essential that when we actually, take any job or any position, we don't necessarily know what type of institutional culture we may have. I am greatly blessed and that I work with a wonderful boss, a visionary, but also a very caring, collaborative practice group. And I think that is really important. I am a provider. None of my physicians just call me a nurse. I am as equally as important as they are. We consult with each other, and for the most part, what's really so amazing is the fact that most of our sports medicine physician would call us for contraceptive consultations. I mean, it's really amazing, especially if you have, the athlete triage, triad, or PCOS. So for me, I think really understanding your culture, really fostering or nurturing a collaborative practice environment, I think make it for really a more fulfilling place to be, and I think people would feel more accomplished if they're in that type of environment.
For me, I look at it as a collaborative effort for everything that we do. I have the luxury of having my leadership. Audrey Simons has been a wonderful, wonderful leader, and Dr. Scolarte as well. They've given me the freedom to run the clinic on my own with very little flag. They trust me. And so when I approach the clinic, I look at it as, what do I need to get done? I don't look at it as I'm an MD and I have certain roles and MDs have certain roles. I look at it as, we need to get this done in order to take care of these for our patients. So I empower our MAs, they're MAs, they're highly capable. I give them as much responsibility as everybody can take, because the stronger our team is, the better we can provide the services for our patients. So I don't look at it as differentiating. I'm an NP, I should watch certain stuff and what I can do and what I can't do. I've been given the task of joining the clinic. I'm going to do it to the best of my ability. I'm going to allow the people underneath me to run it to the best of their ability as well.
So working in a hospital, of course, I am in contact with physicians all the time. When I first started, there was some resistance to me at the hospital level, not with the actual physicians I work with. But I just stood my ground. I just kept doing what I was doing. I love working with patients. I keep focusing on the patients and just keep doing great work. And slowly but surely, I won people over. I mean, the physicians who weren't used to it. I was one of the first, in our company, I was the first nurse practitioner to work in a hospital, to be in the hospital, so I fought for it. Because for some reason I knew that was something where I could be so beneficial. And so I sort of chipped away at it. I just keep doing what I'm doing, and I keep focusing on the patients. Because they're the ones that just appreciate all that extra time I take with them, the explaining, and pretty soon the people, because I've been at this hospital for about 5 years, I guess, this one hospital. Pretty soon, if you keep to your work and keep doing your work and keep focusing on what's really important to your patients, people notice and people start to respect you for how hard you work and for what you do. And I would say right now, I collaborate with the physicians. I call consults on my own, and I love the nurses. Louisa works there, and I just always will ask them, hey, how's the patient doing? What do you think? I'm not barking out orders to them. I'm asking, what do you think? What's the patient doing? What do you think the patient needs? So, like Johnny said, and like you said, it's really collaborative. And over time, I just feel like I am part of the team, and I was respected for my role. And when patients say, hey doc this, hey doc that, I say, actually, this is what nurse practitioners do. Thank you very much, because I know they're showing me respect, but I say, this is what a nurse practitioner does. This is what we do.
You had a question, comment here.
My question was just a little more direct. You work for Regal?
Yes.
So does Regal have that home visiting?
Yes.
Oh, okay. a new role?
Yeah, I didn't really speak a lot about that, but I think it's something that's really becoming popular. So for a while, we have a visiting home NP, and visiting those patients in particular right after the hospital, trying to keep them out of the hospital, those ones that might have bounced back. And but there's now, when I was doing my research, there are nurse practitioners that have their own home visiting practice. Hospitals are hiring home visiting nurse practitioners. Companies that provide home visiting nurse practitioners to provider groups, because it's such a needed area, again, with these, particularly these older people who are maybe housebound and have so many chronic conditions. To have the healthcare come to them is a huge benefit, and for the most part, it's nurse practitioners that are doing this.
Have 3 questions, sir? Catherine?
No, I think she went.
Oh, I had a comment to make. I'm Maria Townsend. I work here as a physician services director. And I have to tell you, I'm so proud of all of you, and I'm very humbled to be in your presence. Providence Holy Cross is the only magnet nursing hospital in the San Fernando and Santa Clarita Valleys. And I have to tell you, I visit with physicians on a daily basis, and I know that your work is very respected by all of our physicians. I mean, I see that there's much more collaboration and respect. And I have 2 wonderful examples. We have 2 of our nurse practitioners that work at our hospital who also work for 2 of our wonderful, and very, very busy surgeons. So even our own surgeons are coming and recruiting our own nurse practitioners. So I really, again, I want to thank you for your hard work, and I can tell you that you are very respected at Providence and by many, many physicians. Dr. Solarte.
Just a comment. I'm Dr. Solarte. I'm the medical director, chief medical officer for San Fernando Community Health Center. I can tell you as a physician that in recent years, the trend is obviously going towards using more nurse practitioners. And personally, my team is all here. Aura, who is an OB specialist, OBGYN. Harmon, who is doing an excellent job in family medicine. Johnny Moyer, family medicine, homeless specialist. Wendy Davidson, who is working with also general medicine and women's services. So just by default, things are happening, and the trend is now that we need more of you folks. There's less of us, a lot more of you. You guys are the hands, you guys are the ears, you guys are the brains behind what we're doing. So if you continue to do what you're doing, continue to work together as a team, continue to join good groups, good leadership, as many of you have said, then the recognition will come over time. Personally, for me, there's no difference between the doctor and a nurse practitioner. What you do is just as important and as essential as anybody else. Part of it, I think, historically, has to do with the fact that you started as a nurse, like you all did. And then the title of nurse practitioner was kind of added on to that. But the way I see it, you guys are all not providers, you're all clinicians. The word provider, unfortunately, not something we did as physicians, it came from other sources, became the title that has been given to all the people that work in medicine. Whether you're a doctor, MD, DO, or a practitioner, you're a provider. I think you're a clinician. So when I see my clinicians in my team and my clinics, I see you as anybody else who's taking care of patients, diagnosing, treating, same respect, same equivalent as one of us, because you're doing the same job that we do, and sometimes for a lot less. So that's invaluable. So I think the word clinician and clinical teams, in my mind, is what I consider all of you. And I think over time, people will notice that, will see that it is something very important, that what you do is not simply based on a title, but based on what you do. You're a clinician. You diagnose and you treat patients every day. So keep doing what you're doing, and you're going to get the recognition you deserve. And my team is 80% nurse practitioners. Thank you all.
Yay.
No, I did not.
How about another raffle?
Okay.
Yes, question.
One, I'm just kind of interested in particular, the gentleman that works patients with the homeless. I mean, clearly, I just read enough articles, they're just, and as you brought out, susceptible to so much violence, and then even sexual violence you didn't cover. And at the same time, you may be dealing with people who may be perpetrators too. I'm just curious what your, like a little bit more about your relationship with law enforcement, what your obligations are as far as reporting, and just kind of how you manage that whole thing as you're in the middle of that community.
Yeah, you mentioned something that's actually really tough. When I come into a room and I see a patient, I don't look at it at a person as a predator or someone who's prey. I'm just trying to help them out. I find out later after reading their discharge paperwork, their history, and then that brings me some pause because I have to realize they're all housed in one single facility with patients that are very, very weak, patients that don't have their minds together, and yet you have patients that are on the prowl, very tough, been on the streets for a while. So the key here in providing safety for all of the patients that are there is to speak with the Harbor Recuperative Care people. They actually house these people. So when I ever find a red flag, I will sit down with their case management team and discuss who I think are predators in order to provide safety for the remaining patients. It's sad that we have to weed out a homeless patient, but if we don't get tough, we're going to leave them the ability to take advantage of some others. So you bring up a very important point. A lot of homeless patients, and I've seen them in the facility, have been discharged from the hospital, not the hospital, but from prison. And they've got nowhere else to go. So they do end up in the ER, and they do end up in recuperative care centers. But that doesn't mean they're all bad. We had some really good patients that have been discharged from prison, but they're trying to get their life together, and they really want to do well. So you can't judge. You just have to go by what you feel and how these patients are reacting. The key is staying on top of these patients on a daily basis. You've got to monitor who you're working with. You then identify who could be a potential problem, and you monitor the activities. And you got to be firm. Some of the case managers are a little too soft, and being too soft makes other patients a target for somebody who's looking to be a target. So it's a great line. There isn't a specific straight answer that I can give to you. A lot of it is feel, a lot of it is using common sense and following through and making sure we're following people that might be predators. Hopefully that can answer your question.
You asked about, again, I work in a college population, but procedurally, if there's any sexual violence involved, clearly you have the police services, and we collaborate with our police services as well. And as mandated reporters, we definitely have to complete the clearing report. From a male or female standpoint who's been sexually violated, first and foremost, there's a need for definitely advocacy and compassion. So we collaborate with our Northridge Hospital is our nearest hospital from CSUN, and Strength United. And so again, immediately there's there is a very quick, organized, strategic way of getting this male or female, getting the police report, and then getting the forensics done. At least our responsibility for doing the clearing report is if indeed the male or the female would file a police report for further investigation, then this will also use for statistics, and we post everything basically about our data, because again, it's a big campus. We're 38,000 students. I think one of the things that I did not, if I may just take a moment, I also do, I'm also the health informaticist in our clinic, and so I do data analytics. Numbers are my game. I do love, our students now are, you go to a Subway, and if you take this survey, you get one free cookie. So we have the same concept, so to speak, so we measure everything. We do the National College Health Assessment, etc. And we actually just really know exactly where you measure the quality, your outcomes, et cetera, based on the type of service that you provide. So that's also one area of interest of mine. But procedurally, that's what we do.
Yes, please.
Yes, I had a question for Johnny, and thank you so much for all you do for our homeless population. Do you have regular meetings with Dr. Fisher, our ER director, and his physicians?
I wish I did. I think it would have more of a positive impact for both of our organizations if I could do that.
We will make it happen.
That would be wonderful. I tell you, there's been so many patients where they're on the edge of getting better, and we're just short by just a little bit of time. And we're calling in and asking for that additional extension. It would save the hospital so much money if we just use this a little bit more money to get them stable. And the heartbreaking thing is we get an answer of no. So if I hope to get myself in front of your director and explain my case, I think we can make a better impact that way. So
I'll give
very
you my
much.
word, I will have Dr. Fisher come to your center and meet with you.
Oh, that would be great. He can see exactly everything that we're
Yes.
doing. He can see the patients we're working with, the complexity. There's nothing like being there firsthand and
Very.
seeing what we're doing.